name's Kate Cooper, and I'm going to be performing my parental checkoff today. I have an order here for the patient, George Monster Jones. His date of birth is 10/1XX. The order is for methylprednisolone, 30 milligrams IM daily at 0-900. He is allergic to penicillin, but there's no contraindications between methylprednisolone and penicillin. It is now 8:50. I'm going to verify that I have the correct medication here. So I have methylprednisolone, 30 milligrams. I have 40 milligrams on hand, but I've done my dosage calculation and I know that I'll be given 0.8 milliliters. This will be given IM daily at 0-900. Again, it is 8:50 for the patient George Monster Jones, date of birth 10/1XX. He has an allergy to penicillin and there's no contraindications between methylprednisolone and penicillin. I have a 3 ml syringe here and a blunt tip needle to draw up my medication, and I have a 22 gauge 1.5 inch needle to administer my medication. Now I'm going to perform my second med check outside of the patient's room. So again, I have an order for George Monster Jones, date of birth 10/1XX. The order is for methylprednisolone, 30 milligrams IM daily at 0-900. And again, it is 8:50. He's allergic to penicillin and there's no contraindications between methylprednisolone and penicillin. I'm going to make sure that I have the correct medication on hand. I have methylprednisolone, 30 milligrams. I have 40 milligrams, and I've done my dosage calculation, and I know that I'll be given 0.8 milliliters. This will be given IM daily at 0-900, and again, it is 8:50. Now I'm going to enter my patient's room. Hey, Mr. Jones, my name's Kate. I'm going to be your nurse today. I'm going to go ahead and provide us some privacy. All right. I'm going to come on over here. Perform hand hygiene. All right, and I'm going to raise the bed to a good working height. I'm going to lower the side rail. All right, Mr. Jones, can you verify your full name and date of birth for me? George Monster Jones, 10/1XX, okay? I'm going to verify that against your armband over here, okay? So I have George Monster Jones, 10/1XX. George Monster Jones, 10/1XX. Okay, perfect. So Mr. Jones, I'm going to be administering a methylprednisolone injection today. That is going to help relieve some of your pain and swelling due to your arthritis. Are you allergic to any medications that you're aware of? Penicillin? Okay, that's what I have here on your chart. Are you allergic to methylprednisolone or any other medications that you know of? No? Okay, great. All right, Mr. Jones. So this morning I have checked your blood glucose level, and it was 90, which is within the therapeutic range. The therapeutic range is 70 to 110. I've also checked your blood pressure, and it was within therapeutic range as well. It was 120/80. Your weight this morning was 170, and your potassium level was 4, and that's also within therapeutic range because the therapeutic range is 3.5 to 5. All right, Mr. Jones. So after I administer this medication, there are a few side effects that we'll be monitoring you for. It can cause some insomnia, which means that you might have a little trouble sleeping. So if that occurs, just let me know. It can also cause a headache. So if you have a headache, let me know of that as well. It can also cause you to have some high blood pressure readings. So I'll be continuing to monitor your blood pressure, and it may cause some weight gain as well. So we'll continue to monitor your daily weights. Okay? So now I'm going to perform my third med check. So I have methylprednisolone, 30 milligrams. I have 40 milligrams. I've done my dosage calculation, and I know that I'll be given 0.8 milliliters of methylprednisolone. This will be given IM daily at 0-900. This is for the patient George Monster Jones, date of birth 10/1XX. He has an allergy to penicillin, and there's no contraindications between methylprednisolone and penicillin, and it is now 0-900. And Mr. Jones, can you verify where they gave you your previous methylprednisolone injection? On your right ventrogluteal site? Okay, that's what I have here on your medication record. So I'll be administering that on your left ventrogluteal site today. And it is contraindicated to give that in the deltoid area, so that's why we're not giving it there, because it could cause some atrophy in the deltoid area, okay? All right, so now, Mr. Jones, I'm gonna go ahead and uncover you a little bit here and get you in position for this injection, okay? So I'm just going to have you roll over for me. And I am going to have you just flex your legs a little and just bend that left leg up. And just grab onto that side rail for me. All right, Mr. Jones. So now I will be giving this medication here, what I'll be showing you is that I'll be putting the palm of my hand over the greater trochanter with my thumb pointing towards the umbilicus. I would spread my index and middle finger apart, and I would be giving it right here in between the index and middle finger, in between these two knuckles right here. Okay, so now that I have him ready and in position, I'm going to go ahead and clean my site. So I would clean my site for 30 seconds and I would let that dry. I would also clean my vial, as it is a multi-dose vial. Let that dry. I'm going to grab my 3 ml syringe and my blunt tip needle. And I'm going to draw up 0.8 milliliters of air. So 0.8 milliliters of air. And I'm going to inject that here into the methylprednisolone vial. Inject the air, invert. And I'm going to draw up 0.8 milliliters of the methylprednisolone. Okay, and I'm going to make sure that there's no air bubbles and prime the syringe. Okay, and I have 0.8 milliliters of methylprednisolone. Now I'm going to use the scoop method to scoop up the cap. I would discard of this blunt tip needle in the appropriate sharps container. Now I'm going to put my 22 gauge 1.5 inch needle onto my syringe. And again, just make sure that there's no air bubbles. Now I'm going to make sure that my bevel is up. I'm going to use the Z-track method and retract the skin laterally. Again, like I said, the bevel is up. I'm going to inject at a 90-degree angle. And I'm going to aspirate for blood. And I do not see any blood. So now I'm going to gently push the medication in. And I would hold that there for 10 seconds. I'm going to retract my needle and retract the skin. Now I'm going to activate the safety mechanism on my needle, and I would dispose of this in the appropriate sharps container. I'm going to get my gauze and I would apply gentle pressure here on the injection site. Okay, now I'm going to move my patient back into normal position. All right, Mr. Jones, are you feeling okay? All right, great. So I'm going to raise the side rail, lower the bed down into the lowest position. Here's your call light. You just press that if you need anything at all, okay? Perform hand hygiene. Now I'm going to document. I gave that at 0900. My initials, I gave it on the left ventrogluteal area. My initials here. I'm going to sign. I'm a student nurse.